20 seconds, guys, so that we can discuss, talk about as many questions as possible, okay? And last 15 minutes is completely dedicated to one-liners, 15-20 minutes, where I have a set of questions here. I will just dictate, you will just write in the comment section, okay? So that even if you don't write, listen to it, revision ho jayega. Okay, now again, as usual, some of you are committing a mistake over here. Ending the poll now. One second. All right, so ending the poll now. Only 60% have got this again correct. Like I've told you before also, person going for self-health checkup, whenever you go for any form of health checkup, guys, any form of checkup, whether your parents have the disease, don't have the disease, whenever you go for a health checkup, it is an example of secondary level of prevention. Why? Because you're trying to make an early diagnosis and you're going to provide an intervention. Am I clear, everybody? Okay, so a person going for self-health checkup to a hospital as his father had died, so he might also be developing the disease which he wants to find out. Risk factor is already there. His father who had suffered from this problem. So now he's going to the hospital to find out whether he has developed the disease or not. Okay. So this is secondary level of prevention. Is it clear, everybody? Okay. One MCQ or question that could come. We all know that early diagnosis and treatment is secondary level. Everybody. Okay, what is early diagnosis and treatment? Screening. Okay. But if I give you an MCQ which could come in your examination, okay, which is if I tell you that prospective screening, okay, don't put in the comment section, just mark a poll. Prospective screening is which level of prevention? Okay, just this way I will be giving you one or two questions that could come. Okay, so primordial, option B, primary, option C, secondary, option D, tertiary. So now mark this. Did you understand the question? I'm asking you, prospective screening is which level of prevention? So everybody think on your minds. What is prospective screening and what is prescriptive screening? I'm only giving you this question because we all know that screening is secondary level of prevention where we have to make an early diagnosis and treatment. Okay. All right, ending the poll now. 57% of you got it correct. Okay. All right. So now, what is prospective screening? What is prospective screening, guys? Yes, Febin, prospective screening is when you screen people for whose benefit? For others' benefit. Okay. So when you screen people at the airports, okay, they have traveled from abroad and they've come and you're screening them. Why are you screening them? For the people, for others' benefit. Okay, so that becomes an example of primary level of prevention. Okay, another MCQ, what is prescriptive screening? And give me an example of prescriptive screening. When you screen people for their own benefits. Okay, like you screen newborns for neonatal hypothyroidism. Okay, clear? Will you remember this? So this was your first MCQ with some additional points. Yes. All right, let's go to the next MCQ for the day, which was again a repeated question. All right, so this was again important. Now you all will revise statistical test today itself after this class or with the class, and you will go for an examination. All right, okay, so do this. This is exactly from August FMG. A researcher did study on male and female staff nurses and JRs doing yoga. It was observed that doing yoga led to 25% decreased risk of NCDs. What is the best statistical significance test to demonstrate? This is a repeated topic, okay? Earlier in FMG, they have asked all our non-parametrical tests except, okay? All right, so I can see only 54% are marking it correctly. So ending the poll now. Guys, what have I taught you? What is the first point, bache, that you're going to look for? Whenever such questions come, you have to look for whether we are talking about quantitative variables or we are talking about what? Very good, qualitative variables. Okay? So now here, are we talking about quantitative or are we talking about qualitative? What are we talking? That study on male and female JRs and staff nurse doing yoga. So here it is NCDs. Okay, yes or no. And here it is yoga. All right, yoga, yes and no. Now I can only say that so many percentage of people practice yoga. I cannot say mean value of yoga is 12. Can I say that? I cannot say that. Okay. So the first point you will look in such questions is whether you're talking quantitative or qualitative, and whether it's given in percentages or proportions. Everybody, is it clear? So look over here. Now it is talking about qualitative variables, okay, like NCDs in yogas, yes or no kind of, and we have also been given percentages. Now, so which type of test? Is it parametric or non-parametric? It is non-parametric statistical test of significance which has to be used. All right, bache. Now, non-parametric may think which out of these are non-parametric. There's just one test which is given, chi-square. Now, if we have to talk about parametric test, what do? It is used to talk about quantitative variables, and we compare the means and standard deviations. Very good, Raji. All right, so let's just have a look at some of the tests and compare with the non-parametric side, because this is a repeated topic, can come again tomorrow in some on fourth in some other fashion. Okay, so when I write over here parametric, you are going to put in the comment section. Okay, and when I write here non-parametric, okay. All right. Parametric is for normal distribution, yes or no? Is parametric test for normal distribution, yes or no? Quickly in the comment section. Is parametric test for normal distribution? Yes, very good. So this could be another question that could come, normal distribution, and this is for skewed distribution. Which out of the two is more powerful? Parametric tests are more powerful or non-parametric tests are more powerful? Quickly, which out of the two are more powerful? Very good. So parametric tests are more powerful and they are less powerful. Okay? So let's compare the tests. Okay, the first test over here that is going to come is t-test. T-test में two things है, paired t-test and unpaired. Okay, now counterpart of paired t-test on the non-parametric test, on the non-parametric side is, guys, sign rank test. Okay, sign rank test or sign test. Okay, and unpaired t-test के लिए क्या होता है? Paired is when you have to compare the means of a single group of patients. Please remember, single group. Okay, single group before and after treatment. All right, unpaired is, say, mean hemoglobin of males versus females. All right, that is unpaired. What is the counterpart of unpaired t-test, guys? Anybody? Chi-square test, or there is one more test. What is it? Chi-square test can be for two groups also or more than two groups also. One test which is only for two groups, very good, Rutvik. It is Mann-Whitney-U test. Okay, Mann-Whitney-U test. Now, for more than two groups, when you have to compare means and SDs, it is ANOVA. ANOVA ka counterpart could be chi-square also, or you could also get, you never know, one-way ANOVA. So just know the name. Its counterpart for one-way ANOVA, guys, is Kruskal-Wallis. Okay, and for two-way ANOVA, what is the test? It is Friedman test. Okay, so just know the name. Last time they gave you with an example. This time they can give you which out of the following are parametric, which out of the following are non-parametric. Is it clear, everybody? Okay. Then Z-test. Z-test is parametric or non-parametric? Quickly, Z-test, quick revision, is parametric. All these tests, okay, t-test ho gaya, ANOVA ho gaya, all of these are used when your sample size is less than 30. Z-test is used when your sample size is more than 30. Okay, it's a parametric test. And one more test, what is the Fisher's test? Fisher's test is again a non-parametric test which is used when we are talking about qualitative data, but the sample size is less than 30. Okay, is it clear? Also, when you make this 2 by 2 group like this, now, if in any of the blocks my sample is less than 5, we are going to use a Fisher's test. Is it clear, guys? If the sample size is less than 5 in any of the blocks, we are going to use a Fisher's test. Okay? So at the end, again, I'm going to ask you one-liners. I'll just ask you, ANOVA is which type of test? You will be putting it in the comment section. All right, everyone, good to go to the next question. So over here, if you see, they had given you yoga and NCD, which is qualitative variable. They had also given you percentages and proportions. So it becomes chi-square test. All right. So we can expect this question again. All right. Now, this was your question that had come for your school health scenario, okay, or school health examination. Now, what I'm going to do is I'm just going to ask you true and false, okay? So in a school scenario, school health guidelines include, okay? So the first question is, yes, you just have to poll in 5 seconds. Any questions, please put in the question section. We will address it at the end. You know, in between of comments, many times I might be missing your questions, okay? All right, so very few of you are getting it correct. Somebody asked me chi-square and Fisher's, but your chi-square test is always used as a non-parametric test, okay? Now, when the sample size, when you're comparing qualitative data, talking about percentages and proportions, but your sample size is less than 30, then you're going to use Fisher's test, okay? Or in any of the blocks, if it's less than equal to 5, you're going to use Fisher's test. Now, only 42% got it correct. In school scenario, school health guidelines, what is the minimum area that has to be provided to students? Very good, Himani. So this is false. 10 square feet. Okay, school health. It is a repeated question. I'll tell you the question before also what they had asked. Okay, as a one-liner, just following this. Okay, so this is false. We need 10 square feet space per child. Is it clear? Okay, very good, Karthik. Not 5. So most of you got this correct. School health, you have to revise it. Okay, next question. Quickly poll it. In school scenarios, do we have minus type desk or plus type desk? Quickly. Good. So only 5 seconds on the clock now. So this 100% should have got it correct. Ending the poll, guys. It is absolutely true. Minus type. Minus type mein kya hota hai? The desks are little, this thing, so that your back and your spine are aligned at the same level. Okay. Then can allot 60 students per classroom? Quickly. True or false? School health is an important topic. Okay. For FMG, मैंने बहुत बार देखा है, they give this question. You can allot 60 students per class, or how many students per class? 5 seconds on the clock. Very good. Ending the poll now. One one classroom, we can allot how many students per classroom? 40. So this was absolutely false. Okay. Then light coming from front of the classroom. Is it true or is it false? Quickly tell me. Light coming from the front of the classroom. True or false? Okay, ending the poll now. Good. This is absolutely false. From where the light should come? Light, LL from the left side. Why left side? Because most of the students are right-handed. Okay, therefore the light should at least come from the left side of the class. Now, one-liners. Okay, the one that could be asked. One urinal for how many students? Quickly. One urinal according to school health service. Next time they can ask about this. Very good. 60. Okay, then one latrine for how many students? One latrine, 100. Okay. School health examination is recommended every 1 month, 3 months, 6 months, 1 year, 2 years. Every 6 months. Very good. So we have revised this. Okay. One more MCQ that could come is doors plus windows. Okay. Doors plus windows should cover what percentage of floor area? Very good. Should be more than equal to 25% of floor area. Is it clear, everybody? Okay. Now, just before this, in 2019, from school health examination or 2018, they gave a question which was, what is the cutoff for I when the teacher has to refer the child? In school I examination, what is the cutoff level when the teacher should recommend the child to which centers? Very good. It is less than 6/9. Remember it. Another question, where should the teacher refer the child to? Very good. Vision center. Vision center mein who is going to be sitting? Paramedical ophthalmic assistant. Okay, who is going to screen the child? Okay. Is it clear, everybody? Okay, after vision center, you have service centers. In service centers, you start with cataract surgeries that we've discussed. So this is very important from school health examination. Okay, now tell me this one. This also came in your exam, somewhat a similar question. A researcher undertakes, and I see a lot of students are having doubts in this. A researcher undertakes follow-up study for a certain time period and tells that the people increasingly develop the disease with time. Then it is expressed as, come on guys, mark it, think and mark it. Okay, don't be in a rush. We have some more good one-liners which I definitely want to tell you. Done, everyone? Okay, so only 48% have got it correct. Now, most of you marked prevalence. No. Now, there is a hint in this question. Okay, they go. Prevalence is new plus old cases. So, don't think that a researcher undertakes follow-up study for a certain. First, the person is taking a follow-up study. What is a follow-up study? Any other name for a follow-up study? I'll tell you what the hints are so that you can mark the question. Okay, follow-up study is a cohort. What do you calculate in a cohort study? What are you able to find out in a cohort study? You are able to calculate incidence. Okay, so since this was a follow-up study, one option which is prevalence is automatically out. Are you understanding? It's a follow-up study. You are following the patient. So it can never be prevalence, because prevalence is given by which type of study, guys? In the comment section, prevalence is given by, again, a one-liner. It is given by cross-sectional study design. Okay. And in cross-sectional study design, you determine both exposure and outcome at the same time. What is the one point? What is the disadvantage of a cross-sectional study? It cannot establish, fill in the blanks, again an MCQ. It cannot establish temporality, okay, which means cause precedes effect. वो नहीं कर सकता. So this was out. Now, it tells that a study for a certain time period. Period is not incidence. Period is cumulative incidence. Incidence is number of new cases developing at a particular point of time. Are you understanding? What is period? The probability of, the probability of, guys, get this very clear, because I'll give you one more MCQ so that you don't get confused. Probability of developing a disease over a period of time. Okay, period of time matlab from say 1st January, say 30th June. Okay, but number of new cases that are going to develop on 1st of Jan only is what? That is incidence. Okay, is it clear? So this is developed over a certain time period and tells that the people increasingly develop the disease with time. So increasingly develop matlab it's going on collecting. Okay, therefore it is cumulative incidence. Is it clear? There were two hints, follow up. So it's a cohort study. Of course, they're talking about period means cumulative incidence. It cannot be incidence, and also the cases are increasingly developed. So it is like it's getting collected. Now try to do this one. This was sent to me on Telegram. Okay, so what are you going to mark for this? Again, some children had confusion regarding one or two options. So suppose something like this come, aap kya mark karoge? Okay, good. So again, students have the confusion that I was expecting. So we'll quickly discuss it. During COVID pandemic, many individuals got infected and recovered. Recovered cases again developed disease, okay, which is the best parameter. Now, please remember, guys, over here, when recovered cases, yes, recovered cases develop karte hain na disease, it's just adding up to the existing number of diseases, okay, it's adding up to the numbers. Secondary attack rate, which most of you marked, what is secondary attack rate? This is again an MCQ which has come in FMG a lot of time. What is secondary attack rate? It tells us about what? Does it tell us about the virulence of a disease? No, it tells us about the disease communicability, okay, communicability, which means the number of secondary cases that are developed within one incubation period over the number of susceptibles, okay, multiplied by what? Multiplied by 100. So this is actually a proportion. All right, now from both the numerator and denominator, you have to subtract the primary case. We have done this a lot of times in certain numericals also, okay. So secondary attack rate is, suppose I get exposed to a measles case, or somebody, a child gets exposed, develops the disease, so that is when it is counted as secondary attack. When the child again gets measles after some time, that is not secondary, okay, it's more than secondary. So wo kya kar raha hai? It's simply adding to the cases. Are you understanding? Therefore it is cumulative incidence. It cannot be incidence. Why? Because it's not a new case, it has been again infected, okay. Why it cannot be prevalence? Because it is yes, it cannot be prevalence because we're not talking about at a particular point. Are you understanding, everybody? So this is cumulative incidence. It will go on increasing the cases at a time, okay. Anybody has any doubt, please put on the comment section. All right, okay. Then this was asked in your examination.